Assalamu alaikum. I am Dr. Asma Hosna, Associate Professor, Department of Pathology, Bashundhara Ad-din Medical College, South Keraniganj, Dhaka. My dear student, hope all of you are doing well. Welcome to you all today's pathology online class. Today I am going to discuss about the endocrine system. We know there are major endocrine glands in our body like pineal body, hypothalamus, pituitary gland, thyroid gland, parathyroid gland, adrenal gland, pancreas and the reproductive organ. So, today in this class I will discuss about the disease of the thyroid gland. Before going to the pathology session, you have to know about the basic anatomy and the physiological function of thyroid gland. So, we know that thyroid gland is a ductless alveolar gland which is located anterior to the neck, just below the laryngeal prominence, which is called Adam's apple, and it is roughly butterfly shaped. It has two lobes, right lobe and the left lobe, and the both lobes are attached by an isthmus. And the thyroid gland is not normally usually palpable. When there is a pathology on the thyroid gland is palpable. Now, come to the physiology. As thyroid gland is an endocrine gland, that means it secretes hormone. We know there are two important hormone, one is thyroxine T4 and another one is triiodothyronine, that means T3, which regulate metabolic body process, cellular respiration, total energy expenditure growth, maturation of the tissue and turnover of hormones, substrate and vitamins. Now, how this thyroid hormone is regulated in our body? Secretion of the thyroid hormone, that means T3 and T4 hormone, is controlled by trophic factor, and this trophic factor is secreted both hypothalamus and the anterior pituitary. When there is a decreased level of T3 and T4 in our body, at that time there are release of thyrotrope releasing hormone from the hypothalamus, and it also causes stimulation of the thyroid stimulating hormone from the anterior pituitary, and ultimately there is increased the level of T3 and T4 hormone in our body, and elevated T3 and T4 level in turn feedback to suppress the secretion of both thyrotrope releasing hormone and thyroid stimulating hormone. Now, dear student, comes to our pathology portion. What are the diseases of thyroid gland? The disease of the thyroid gland include thyrotoxicosis, hypothyroidism, which include cretinism and myxedema, then thyroiditis. It include Hashimoto thyroiditis, subacute lymphocytic thyroiditis, subacute granulomatous thyroiditis, then Graves' disease, goiter. Goiter included diffuse non-toxic goiter and multinodular goiter. Then tumor, it may be benign or malignant tumor. These are the disease of a thyroid gland. Now, I am going to elaborate what is hyperthyroidism. Hyperthyroidism, also called thyrotoxicosis, it is a hypermetabolic state caused by elevated level of free T3 and T4 level, and it is caused most commonly by hyperfunction of the thyroid gland, and so it is referred as hyperthyroidism. What are the causes of thyrotoxicosis? We can classify it into two broad categories. One is associated with thyrotoxicosis and another one is not associated with thyrotoxicosis. Associated with thyrotoxicosis or hyperthyroidism can also classified into two ways, primary and secondary. And the primary causes include Graves' disease, toxic multinodular goiter, toxic adenoma, hyperfunctioning thyroid carcinoma, iodine induced hyperthyroidism and neonatal thyrotoxicosis associated with maternal Graves' disease. and the secondary cause include thyroid stimulating hormone secreting pituitary adenoma. And then the not associated with hyperthyroidism, it included subacute granulomatous thyroiditis, subacute lymphocytic thyroiditis, stroma ovary and factitious thyrotoxicosis. So, there are many causes for developing hyperthyroidism or thyrotoxicosis, but the most important three causes are: number 1 Graves' disease, number 2 hyperfunctional multinodular goiter, and lastly hyperfunctional thyroid adenoma. Now come to the clinical manifestation. As I have already mentioned you that it is a hypermetabolic state, and so there is overactivity, oversympathetic activity occur, and so ultimately there are presence of cardiac manifestation, and this cardiac manifestation include tachycardia, palpitation, arrhythmia and cardiomegaly. And due to higher level of calorogenesis, patient may suffer heat intolerance and sweating, and high catabolic metabolism, patient also may suffer from weight loss. Then how can we diagnose a case of hyperthyroidism? For the diagnosis of the hyperthyroidism, we have to measure serum thyroid stimulating hormone, serum T3 level and serum T4 level. And among these three tests, the thyroid stimulating hormone test is the most useful single screening test for hyperthyroidism. A low level of thyroid stimulating hormone value is usually confirmed with measurement of free T4 level, which is expectedly increased. Then our next topics, I am going to elaborate about hypothyroidism. Hypothyroidism is caused by any structural or functional rearrangement that interfere with the production of adequate level of thyroid hormone. That means it reduces production of thyroid hormone, and it is more common in women than the men, and it is nearly 10-fold more common in women than the men. Now, what are the causes of hypothyroidism? We can also classify this disorder into three categories: primary, secondary and the tertiary. And the primary cause include developmental, thyroid hormone resistance syndrome, post ablative, that means surgery, radioiodine therapy, autoimmune hypothyroidism, that means Hashimoto thyroiditis, iodine deficiency, drug and congenital biosynthetic defect. And the secondary cause include pituitary failure, and the tertiary cause include hypothalamic failure. Then what is cretinism and myxedema? Cretinism is a hypothyroidism, but it is developed in infancy or early childhood, and myxedema, it also refers to a hypothyroidism, but it is developed in older child or adult. Then how can you diagnose a case of hypothyroidism? Like hyperthyroidism, here we also measure the serum thyroid stimulating hormone, serum T3 level and serum T4 level, and TSH is value is increased in primary hypothyroidism, and T4 level are decreased in patient with hypothyroidism of any origin. That is all about today, my dear student. Inshallah, see you again in the next class. Stay home and stay safe. Till then, Allah Hafiz.